Hello, I'm Dr. James. Did you know that some daily habits, which seem harmless, can quietly undermine your intimate health? Many women believe they are protecting themselves, but unknowingly create an ideal environment for infections, irritation, and discomfort. In this video, I'll reveal 5 common habits that can compromise vaginal health. And the last one, it's probably the most surprising of all. I bet you've done it at least once, thinking it was the right thing to do. As a gynecologist with years of experience, I've dedicated my practice to helping women better understand their bodies and care for their intimate health in a natural, balanced, and straightforward way. Vaginal infections are far more common than they seem, and they are often linked to small, everyday actions, rather than a lack of hygiene, as many people mistakenly believe. The problem is that a lot of misinformation still exists. Thousands of women follow incorrect advice or repeat popular habits that appear beneficial, but ultimately disrupt the natural balance of the intimate area. That's why, in this video, I'll explain in a simple and objective way which behaviors weaken your vagina's natural defenses and what you can do to restore balance without risks or unnecessary medications. Grab a pen and paper, because today's content will help you understand what your body truly needs and what it can certainly do without. If you want to continue learning about women's health and longevity, make sure to follow this channel so you don't miss future videos. How the vagina protects you and why small mistakes disrupt its balance. The female intimate area has an incredibly intelligent natural defense system. The vaginal pH is slightly acidic, a crucial condition for maintaining a healthy balance between beneficial and harmful bacteria. These beneficial bacteria, known as lactobacilli, act as natural guardians. They form a protective barrier that prevents fungi and harmful microorganisms from multiplying. When this balance is maintained, the vaginal flora remains healthy, free from odors, irritation, and with effective protection against infections. The problem begins when small, daily actions disrupt this delicate environment. Simple things like excessive washing, using perfumed products, wearing very tight clothing, or even certain types of sanitary pads can alter the pH and reduce the number of lactobacilli. When the pH stops being acidic and becomes more neutral or alkaline, the natural barrier weakens. This is when symptoms like itching, burning, abnormal discharge, and even unpleasant odors can appear. If this imbalance persists, it can lead to more serious infections such as candidiasis, bacterial vaginosis, and even recurrent urinary tract infections. Therefore, caring for your intimate health doesn't mean obsessive cleaning or using harsh products. It means respecting the body's natural balance, allowing the vaginal flora to function as it's designed to, autonomously and protectively. Habit 1. Internal vaginal douches. Many women believe that washing the inside of the vagina is synonymous with hygiene. This idea seems logical. If external cleaning is beneficial, internal cleaning must be even better. But in reality, the opposite is true. The vagina is a self-cleaning organ. It possesses a natural defense system that eliminates impurities and maintains its internal equilibrium without requiring external intervention. When you use an internal douche, this delicate mechanism is disrupted. The jet of water, or the cleaning solution, removes not only impurities, but also the lactobacilli, the beneficial bacteria responsible for maintaining an acidic environment and preventing the proliferation of harmful microorganisms. The result is a vulnerable environment that encourages the growth of fungi and undesirable bacteria. Research shows that frequent douching increases the risk of bacterial vaginosis, candidiasis, and even pelvic inflammatory disease, a condition that can affect fertility. During pregnancy, the risks are even higher, as the procedure can cause irritation, infections, and even complications during gestation. It's vital to understand that the vagina cleans itself. Hygiene should focus only on the external area, using mild products and gentle movements. When you interfere excessively, you destroy the natural protection that your body has developed over millions of years. Think of it this way. If the internal balance is like a swimming pool with the right amount of chlorine, internal douches are like removing the chlorine and allowing algae to grow unchecked. So, let go of this habit forever. The inside of the vagina doesn't need to be washed. It needs to be respected. Habit 2. Synthetic or very tight underwear. Few women realize how directly the type of underwear and fabric chosen can affect vaginal health. Synthetic, lacy, or very tight garments might look elegant, but they often transform the intimate area into an environment conducive to infections. Fabrics like polyester, nylon, or spandex don't allow the skin to breathe properly. They trap heat and moisture, two factors that combine to encourage the proliferation of fungi and bacteria. Furthermore, the constant friction from very tight clothing irritates the sensitive skin of the vulva, causing itching, redness, and even minor lesions. The intimate area is naturally warm and moist. When you add a fabric that hinders ventilation, you create an ideal breeding ground for candidiasis and chafing. Therefore, the best choice is cotton, a light, breathable fabric with good absorbency for natural moisture. Prioritize underwear with a cotton lining and clothing that doesn't compress the area. Whenever possible, opt for looser clothing, dresses or skirts, which promote ventilation and help maintain thermal regulation. Another important tip is to avoid staying in wet or sweaty clothes for too long. After exercising, visiting the beach, or swimming, change your underwear as soon as possible. Trapped moisture is one of the main factors that trigger infections. And at home, allow your body to breathe. For example, sleeping without underwear is a simple practice that helps reduce humidity and prevent irritation. Small gestures like this significantly impact intimate health in the long run. Remember, comfort is an important part of hygiene. If clothing traps air and irritates the skin, it's not enhancing your beauty, it's harming your body. Habit 3. Overdoing intimate hygiene. It might sound strange, but excessive cleanliness is one of the most common mistakes when it comes to intimate health. Many women believe that washing several times a day, using strong soaps or perfumed wipes are signs of care. In reality, this excess destroys the area's natural defenses. The skin and mucous membranes of the vulva have a delicate balance. When you use common soaps, antimicrobial products, or those with artificial fragrances, the natural pH is disrupted. These products strip away lactobacilli, dry out the tissue, and make the area more vulnerable to irritation and the invasion of microorganisms. Even intimate soaps, when used in excess, can cause imbalance. Ideally, hygiene should be performed once or twice a day, preferably during your shower. Beyond that, the effect ceases to be protective and becomes aggressive. Hygiene should only be done externally, between the labia, using your hands, without sponges, loofahs, or washcloths. Soap should never be applied inside the vagina. If the weather is very hot, or after physical exercise, simply rinsing with water is sufficient. Remember, intimate hygiene is not a matter of quantity, but of balance. The goal is to maintain the health, moisture, and protection of the area, not sterility. The female body possesses natural wisdom. When you try to correct what it does perfectly, you interfere with a process that is designed to protect you. Habit 4. Daily use of wet wipes. They are convenient, fragrant, and provide an instant feeling of freshness. But few people realize that, with frequent use, wet wipes can cause the opposite effect: irritation, itching, and even recurrent infections. Most of these products contain alcohol, artificial fragrances, preservatives, and chemicals that are not designed for constant use in the intimate area. The vaginal mucosa is much more sensitive than the skin on other parts of the body. Daily contact with these substances eventually damages the natural protective barrier. Over time, constant wipe usage can alter the region's pH, cause tissue dryness, and eliminate some of the lactobacilli, the beneficial bacteria responsible for protecting the vaginal canal. The result is an increased risk of candidiasis, dermatitis, and allergic reactions. This doesn't mean wipes should be entirely banned. They should be used consciously. They can be useful in isolated situations, such as during a long trip, at an event without access to a shower, or when washing with water isn't possible. In such cases, choose wipes that are alcohol-free, unscented, and specifically designed for the intimate area. Even then, use only what's necessary and avoid harsh rubbing. Never use baby wipes or regular cosmetic wipes in this area. They are made for a different skin type. And remember, wipes are not a substitute for bathing. They are emergency aids, not a routine. The best way to care for your intimate area is always with water and mild products, respecting the body's natural balance. True freshness comes from feeling healthy, not from a chemical scent. Habit 5. Constant daily use of panty liners. Of all the harmful habits, this is perhaps the most common and also the most deceptive. Many women use panty liners daily, believing they keep their underwear clean, prevent odors, and protect against infections. But in practice, the effect is quite the opposite. The constant use of panty liners creates an artificial barrier that prevents the skin from breathing. Most of these products have a waterproof plastic layer that blocks ventilation of the intimate area. This causes heat and moisture to become trapped, creating an ideal environment for fungi and bacteria to multiply. In addition, many liners contain perfumes, gels, and synthetic components that can irritate the delicate skin of the vulva, causing itching, redness, and even allergic reactions. The most frequent result is an increase in cases of candidiasis and bacterial vaginosis, especially in women who believed they were protecting themselves. If you feel the need to use a panty liner daily due to discharge, it's important to understand that this is not normal. Excessive discharge can indicate a hormonal imbalance or an infection, and it's best to consult a specialist to investigate the cause. When their use is truly necessary, for example, at the end of menstruation or during a medical treatment, choose breathable, unscented liners without a waterproof plastic film, and change them several times a day. Outside of these situations, the best thing you can do for your body is to allow the area to breathe naturally. Sleep without underwear, wear cotton fabrics, and avoid constant trapped air. These simple measures preserve the balance of the vaginal flora and prevent infections. Air is the best natural antiseptic that exists, and your intimate skin needs it just as much as the rest of your body. Conclusion. The truth is, a woman's body changes over time, and understanding these changes is key to aging healthily, comfortably, and confidently. Every habit you change, every simple act of care you adopt, strengthens your body's natural balance and genuinely and lastingly protects your intimate health. After 60, the skin becomes more sensitive, the vaginal flora more delicate, and the pH can easily shift. Therefore, respecting your body is the greatest act of self-love. Self-care is not vanity, it is feminine wisdom. If this video helped you better understand your body, please share it with other women in your life, friends, sisters, neighbors. Many of them still believe that certain habits are harmless, when in fact, they are causing the opposite effect. You can be the bridge that conveys information and well-being to those who need it. Share your thoughts in the comments below. Which of these habits surprised you the most, And how do you plan to better care for your intimate health from now on? A big hug, and I'll see you in the next video.